If you remember, a few weeks ago, the Johnson & Johnson vaccine was halted by the CDC because there was a small group of people that had blood clots that were thought to be caused by the Johnson & Johnson vaccine. The Rhode Island Department of Health followed the CDC by placing a hold on the Johnson & Johnson vaccine. We're now letting you know that the Johnson & Johnson vaccine has restarted. The CDC and the State Department of Health have performed a thorough investigation, finding that only 15, though 6 were originally reported by the CDC, had blood clots, and they were not caused by the Johnson & Johnson vaccine. Those 15 people had other health issues, and the clots were not caused by the vaccine. The CDC is comfortable with restarting the administration of the Johnson & Johnson vaccine. The State Department of Health and Governor McKee have decided to follow suit and restart that vaccine here. The Johnson & Johnson vaccine is good and safe vaccine. It's equivalent to Pfizer and Moderna. You may have seen reports on social media, the newspaper, TV, and people saying that the vaccine is not a good vaccine, but this is not true. If you remember, previously the CDC asked Rhode Island for data related to the administration of the Johnson & Johnson prior to it being halted. 31,000 people had received the Johnson & Johnson vaccine, and 0 side effects were reported. 0 deaths were reported, and 0 blood clots were reported, meaning that here in Rhode Island, all 31,000 people who have received the Johnson & Johnson vaccine have been fine. They have had no major side effects from this vaccine. I want you to be aware that the Johnson & Johnson vaccine is back and in use, and that the recommendation it is fine for you to go ahead with that vaccination process. It's a one-time shot and you can move on. You do not need to return for a second shot. Now, when you make an appointment, be sure to note which vaccine you will be receiving and be sure to choose accordingly. Also, if you go into a walk-in center and you're offered the Johnson & Johnson vaccine, go ahead and take it. If you have any questions or concerns about the Johnson & Johnson vaccine, as it specifically relates to your own health and any conditions you may have, it's suggested that you call your doctor first and ask if you should go ahead with the vaccine. The same recommendation is in place to talk to your doctor about concerns before getting any of the 3 vaccines, including Pfizer and Moderna. You can go ahead and call the Rhode Island Department of Health Information Desk, 401-222-8022. One of the Department of Health's nurses and doctors will be able to discuss these issues. Calling me is not advisable because I am not a healthcare professional. I'm simply relaying this information from the news, and I believe what has been stated. The Johnson & Johnson vaccine is a good and equivalent vaccine to Pfizer and Moderna. Thank you.